We recently read an article about heavy metal contamination in baby food, wondering how you can reduce your exposure. Today's episode's just for you.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. And today I want to talk about a topic that I think is really important, not just for pediatricians to be talking to our patients about, but also for OBs and general practitioners to be talking to their pregnant mommies about. Let's talk all about heavy metal exposure in our foods and how to avoid it. So the care here at Be Kind Pediatrics often starts in the second and third trimester. And a lot of parents ask me, why is that? And part of the reason is because the mother's health throughout actually her pregnancy and even before her pregnancy has a really big impact on the baby and their overall development. So as a pediatrician, I'm always very concerned, of course, with children and their development and how we can educate parents on how to optimize their child's development. And so that actually really starts with a conversation early on in pregnancy or when they're planning to become pregnant. And I think it really starts with a question about their overall health, their mental health, of course, overall health, including sleep and nutrition and exercise. But today's episode, I'm going to focus a little bit on the nutrition part. And so why are we concerned, or why am I concerned about heavy metal exposure in the food of pregnant mamas and babies? And that's because heavy metals can have an impact, particularly on vulnerable populations like fetuses, newborns, and infants. And that is because in the first 1,000 days of life, the brain is really undergoing a rapid development, and its peak development happens really from the time that the baby is conceived up until they are 2 years old. And so anything that might disrupt that development, like heavy metals, can have a big lasting lifelong impact on them. And so the best care usually is preventative care. So helping get this information out to parents and educating them on ways that they can reduce some of this risk, I think is an important conversation to have. So really there's 4 heavy metals that we know have toxicity risks for children and fetuses. And those are going to be lead, mercury, and arsenic, as well as cadmium. Lead, as we know, can cause developmental delays and behavioral problems, as well as anemia and damage to important organs like the kidney. Mercury can impair the brain and nervous system development and also have lifelong cognitive motor functions. It also is excreted by the kidney, so it can cause lifelong kidney damage. Arsenic is the third one, and so that can cause increased risk for certain type of cancers, but also increase your risk for poor cardiovascular outcomes. And then cadmium, the fourth one, also can increase your risk for certain cancers and has been associated with poor neurocognitive outcomes. So because of the risk for some of these long-term health outcomes from toxicity from heavy metals, the best way to approach it is to try to avoid them or minimize your risk. So how do you go about doing that, and which foods are of concern? Let's start off with the foods that are concerning. So the first one that is most commonly known about is fish and seafood. Certain seafood particularly can have high levels and has been shown to have high levels of mercury toxicity. And those are going to be your cold water fish. Those are things like shark, swordfish, mackerel, and tilefish. Kind of medium risk fish are going to be tuna, especially the white tuna, marlin, and big-eye tuna. And then the lower risk fish are going to be things like salmon, sardines, trout, herring. Those are generally considered safer sources. When it particularly comes to fish and seafood, I do generally talk to my parents about alternative options that are out there for lower risk seafood. So there's a really nice company. I don't have any sponsorship or relationship to them, but I generally tell my parents about them so they're aware that they have options. There is a really nice company called Seatopia that does provide third-party testing of their seafood to ensure that it has the lowest possible mercury contamination and microplastic contamination. So if this is something that's particularly of concern to you or valuable to you, that might be a good option for your family. Other than that, you want to kind of rotate your moderate and high risk and low risk fish in your diet. So try first to have higher amounts, of course, of the low risk fish. That's going to be like the salmon, sardines, trout. And every once in a while, it is definitely okay for your child to have tuna, mackerel, and tilefish. Those fish still have really important nutrients in them that is a nice complement to your child's diet. So I would never recommend cutting them out. but just eating them proportionately, not making sure they're not the majority of your diet. The next easy food to talk about is rice. Rice has been in the news a lot because the FDA published that they did find arsenic contamination, high levels of arsenic in baby food, particularly the brown rice baby food cereals. They do have a goal currently of reducing the amount of arsenic contamination in baby food, but most parents should be aware that they did have those findings. And because rice does not have a lot of nutritional additional benefits, and we can get those from other sources like whole grain cereals and oats, I generally recommend parents try to either reduce or avoid rice-based cereals and products for their infants and children and consume things more like an oatmeal and oat-based cereal alternative. If you're going to eat rice, it seems like jasmine rice has the least amount of contamination, so that is the option I usually recommend to parents, to go for more of an organic jasmine rice if they can. And then of course, when you prepare your rice, you really want to soak it, make sure that it's draining clear white before you prepare and cook it. Let's talk about other seafood other than fish. So shellfish also have had high levels of metal contamination, particularly mercury and cadmium in them, although it's generally less than predatory fish, because predatory fish eat shellfish and then they accumulate that heavy metal. And so again, there are other options out there, like third-party companies that will do testing to make sure that your fish have safe levels of heavy metals. But again, this is a food where I think it has a lot of nutritional benefit to your child, so you should continue to eat them, but just eat them in rotation and try to mix them in with other fruits and vegetables. Try to source them appropriately when you can. Now I want to talk a little bit about root vegetables and fruits. So anything that sits in the ground can have the potential for heavy metal contamination. And that has to do with what we're using in our fertilizer. That runoff then is absorbed by particularly root vegetables. So rice, for example, sits in a lot of water. Again, our seafood and fish has run off into the streams. And then root vegetables and fruits. So root vegetables and fruits, again, you should not eliminate that from your diet. They have really important micronutrients and benefits for your overall health. You just want to reduce your risk here. And so you can do that by rotating what you're eating. So not eating the exact same root, fruit, and vegetable every day. So if you're eating like sweet potatoes every day, you might want to mix that up sometimes with other vegetables and do a really good job cleaning them and removing the skin where appropriate. So that kind of leads into a really nice conversation about how to minimize your exposure. I've kind of given you some tips and tricks along the way, but let's just summarize quickly kind of the best ways to minimize your exposure to heavy metals. Opt for fish that you know have lower levels of mercury. Those are going to be the salmon and sardine group. The FDA and EPA provide guidelines on which fish are safer choices for pregnant women and young children, so you can always go to their websites and reference that. If you're looking for a vendor, what I recommend is that you look for somebody who has a third party evaluating their fish for heavy metal contamination, so that they're actually bringing in somebody unbiased to check it, and that it is sustainably sourced. 2, try to diversify your diet. So having a varied diet can reduce your exposure to any single contaminant. So trying to not eat the exact same fruits and vegetables every day, the exact same fish every day. 3, rinse and prepare your foods properly. So really washing your fruits and vegetables thoroughly to remove any contaminants. Before you cook rice, rinse it as thoroughly as you can to try to reduce the arsenic levels. 4, if you can, select organic products when available. Organic farming practices can sometimes reduce the risk of heavy metal contamination, although it's definitely not a guarantee. You can take that a step further and look into farms that use regenerative farming, because they may have reduced risk of heavy metal contamination depending on the way that they are fertilizing and using their land. And you can look into CSA options and look at how they are, again, fertilizing and preparing their crops. Lastly, I want to put in, if you have any concerns about heavy metal exposure, particularly if you're pregnant or you have a young child, always consider consulting with your healthcare provider. They might want to or recommend specialized testing, or they might recommend bringing a nutritionist who can really provide personalized advice on how to reduce your risk of exposure to heavy metals while still providing a personalized plan for making sure you're getting in all those important micronutrients. So I want to thank you all for listening to today's episode. I know it is kind of a scary topic to talk about, but I think it's important for healthcare providers to get out there and start advocating for our patients and talking about some of these big topics. I wish, of course, that we didn't have to think about how we can reduce the risk of heavy metals in our food and just have heavy metal-free food. But in the current climate, I think the best you can do as a parent is really just do your best. Try to rotate vegetables when you can. If you can't get organic vegetables, try to choose whole foods. And if you have any concerns, definitely reach out to your pediatrician. If you have any questions or comments, of course, please leave them below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.